Hi, I'm Maggie Fein, and I chose hepatitis C, which is a virus that infects the liver and can cause cirrhosis and other liver issues. So hepatitis is a blood-borne disease, which means that basically the only way you can get it is from contact with infected blood. Now, you can also get it from your mother during birth if she is infected with HCV, but pretty much just blood to blood. Less commonly, you can technically get it through sexual transmission, but usually when people are saying that HCV can be sexually transmitted, it does include the exchange of not only bodily fluids, but also blood during sexual intercourse. So really, it's very unlikely that you get it through sexual transmission. Drug use with needles is the biggest way that people contract HCV. Receiving blood transfusions or organ donations, you can contract HCV or through an accidental needle stick, clinical accidents, piercings or tattoos with needles that aren't clean. But the biggest, most common form is through drug use with needles. Symptoms include fever, fatigue, jaundice, dark urine, abnormal stool, loss of appetite, nausea, joint pain, abdominal pain, and vomiting. The problem with these symptoms is that these symptoms can indicate other sorts of viruses and illnesses, and often are not treated as HCV symptoms. They're treated as, for instance, you would normally just get a couple of these. So if you had fatigue and fever, it might be treated as the flu or some sort of other chronic condition besides HCV, especially if your doctor doesn't have an accurate history of your drug use and your contact with HCV. So who's getting it? There's 2.7 to 3.9 Americans with chronic HCV. That's a pretty significant amount of the population of the United States, which is about 350 million people. And around 30,500 cases in 2014 were recorded, and that's the most recent information. I could not find information on 2015 or 2016, and this is from the Centers for Disease Control and Prevention. This includes chronic and acute cases because it's hard to distinguish between the two as far as recording patient information. So when the CDC does their annual reporting, they include both chronic and acute. Overwhelmingly, injection drug users, or IDUs, which is the clinical term, are getting HCV. In fact, a third of 18 to 30-year-olds are HCV positive if they use injection drugs, and up to 90% of those over 30 are HCV positive, and we'll talk about why in just a minute. So I said that you could get it from a blood transfusion or organ donation, but that's a very, very small chance that would happen. That's been largely eradicated. It used to be the most common way. If you can remember, for instance, another virus, HIV, Ryan White got it from a blood transfusion because he is a hemophiliac. But that doesn't happen so much anymore just with HIV, and it doesn't happen so much anymore with HCV or really anything from a blood transfusion. So why is it overwhelmingly IDUs? Well, like I said, the percentage up to 90% of IDUs have HCV if they're over 30, and that's because in the 1970s and 1980s, and before that even, the dangers of needle sharing were less known. This was right before the precipice of a lot of information about sexually and blood transmitted viruses that emerged around the 1980s. So we didn't really know that much about it. And without needle exchange programs, addicts have to use the needles that are on hand because addiction is also a disease, and they need the needles if they are injection drug users. So in 1992, we introduced high-tech blood screening processes, which basically got rid of the blood transfusion organ donation issue of contracting HCV. Before, it was the most common form of transmission. Now it's just so easy to detect, and transfusions and transplants are much safer, and our screening process for blood is down to a very, very good routine science. So talking about the genome a little bit, it's a positive single-stranded RNA. There are 6 distinct genotypes, but there are more than 50 subtypes, which is why we don't know that much about HCV, because it can present itself in a little tweaks of genetic information can make a big difference in the way that it presents in a patient and the way that the patient needs to be treated. So genotype is very, very important for treatment. So talking about the way that it invades a little bit, it'll invade the liver cell by merging cell membranes, causing the liver cell to have endocytosis of the virus, which allows the virus to create new RNA transcriptase. So basically creating a genetic template, in layman's terms, for the virus to replicate within the liver cell instead of the liver cell genetic information replicating. So then the cell eventually will expel the virus, but the virus will now have a new lipid bilayer that looks like the liver cell, so it can go on to infect more cells. It's basically masking itself with liver genetic information so that it can infiltrate other liver cells. And the way this progresses is different in everyone and can depend on a lot of different factors, including age, alcohol use, cirrhosis of the liver that's already present, and stuff like that. So why is it so dangerous? Well, we don't have a vaccine for it. The chronic patients, which are most of the patients, are usually asymptomatic, or they have one of those ambiguous symptoms I talked about earlier that can present themselves as different diseases or maybe nothing at all. You might just not acknowledge some of those. There's also a high incidence in drug use, and drug use patients may be concerned about the legal issues about reporting an issue with needle injection and may not be seeking the medical care they need. There's also still a lot we don't know about it. We really only discovered the HCV strains in 1989, and we're still learning stuff about them every year. But it's also the #1 cause of liver transplants and liver cancer. So this is a very damaging virus. It can cause a lot of issues in patients, especially those who have weakened livers because of other lifestyle choices or genetic dispositions. So is there any good news about this? Actually, there is. I was surprised to know that a person can be cured of HCV, which means that they have a sustained virologic response, which doctors conclude is 3 or more months with a clean blood test, so no HCV detected, which means that the HCV has essentially been expelled from their system. So a person can be cured, which is pretty interesting and a really good sign because, as you know, as I said, there are millions of Americans are infected, and the number is even greater and in higher proportion of the population worldwide in other countries. So the treatment used to be for a long time interferon, which interferon you already have in your body. So it's part of your immune system, and adding more interferon, the purpose was to boost the immune system so that the body is attacking the virus and not the drug. So this is often used in cancer patients. The problem was, though, that a lot of people were experiencing chemo-like side effects, and this was really detrimental considering these people may have not had a lot of symptoms for HCV. And so when they were getting these negative effects of the drug, they were less likely to continue. And there were other issues because it was a needle. It was an injection of interferon that presented a lot of issues, especially in drug users. So right now, the most common thing we do is direct-acting antivirals. So this treats both chronic and acute. You know how I said there's kind of a blurred line between chronic and acute, just the way they're treated, because a lot of patients could be displaying symptoms, but they've actually had it for a long time, so they're not acute. HCV patients, they're actually chronic HCV patients. You can see how that can be confusing. So they're treated pretty much the same with the same amount of effectiveness. So there's 11 different oral medications in the market, and usually a combination is used, especially if you can't pin down the subtype. But there's different strategies for different genotypes and different strategies for different amounts of cirrhosis or damage, scarring to the liver. But usually in about 8 to 24 weeks, so that 3-month period I was talking about, the HCV does clear out of a person's system. So there are some possibilities on the horizon. Getting injection-free was a huge deal because, like I said, injection drug users, if they were trying to recover, did not like the injections. And if they were not trying to recover, you still have a lot of issues in injecting people who have already a lot of needle use. Plus, why wouldn't you want to take a pill when you instead of a shot? I think a lot of us would choose taking a pill. So large efforts to find new treatments. For one, researchers want to find one pill to cure them all. This would be great because it would add a lot of access worldwide and would be easier to distribute. So what's the prognosis? Well, right now, IDU rates are high. Remember in southern Indiana last year, it was a big issue in the southern counties of Indiana. There were a lot of HIV outbreaks, and it was a big concern for the CDC. And so the rates are still high, really nationwide. However, support groups and HCV information groups are taking the social stigma out of it because a lot of people don't know a lot about it and still assume that it's a sexually transmitted disease or something that only drug users get, and it is something that people have been ashamed of in the past. And so that's being worked on a lot. And preventative measures such as screening, especially if you are a drug user or have had contact with someone or someone in your family is at HCV. It's not genetic, but it is, if someone in your environment has it, you may have a possibility of contracting it. So screening is a great preventative measure, and the needle exchange programs are another preventative measure for a lot of viruses, including HCV, being transmitted through unclean needles. So getting clean needles is actually helping. But really, just learning more, and the more we research it, and the more people educate themselves about HCV, the better that the communities are going to be, and the fewer instances we'll have.